This week on Connected, we're taking you behind the counter to meet the people who make sure our patients get the care they need, our pharmacists. From Mena to Malvern, they're helping build access, trust, and healthier communities. Let's get connected. Welcome to Connected. I'm Marisol. This week, we're celebrating Pharmacy Week by spotlighting some of the incredible people who help make care at Healthy Connections complete. We're talking to 4 of the experts who not only fill prescriptions, they fill a vital role in keeping our patients healthy. Joining me today are Dr. Calandro, Director of Pharmacy Services, Dr. Tang, Clinical Pharmacist, Dr. Sally Kalkbrenner, Clinical Pharmacist at our soon-to-open Malvern Community Pharmacy, and Dr. Alicia Kalinowski, Clinical Pharmacist at our Mena Community Pharmacy. And you've been leading this department from the start. Let's begin with you. What's been happening lately in pharmacy at Healthy Connections?
We're trying to look at specialized diseases such as hepatitis C, HIV, PrEP, various things, niches, some of the biologicals, and trying to get those out to our patients. Since we are an FQHC, we can definitely, buy some things at lesser costs than some of the other, retail box stores, and we try to pass those savings on to our patients. Certainly, the patients who have insurance benefit us greatly because the insurance pays for their money. We try to take those monies and invest them back in the patients who maybe don't have the resources.
That's incredible, Anne. Really focusing on specialized care and affordability. It's not just about filling prescriptions. It's about creating access. And Fee, I love your perspective on pharmacy because it's so people-centered. You take a very patient-first approach. Tell us about your philosophy.
As ironic as it sounds as a pharmacist, I think lifestyle comes first, medicines come second. And so if I could take a medication off your med list, that's my number one priority. And so I'll work with you on your lifestyle, and then we can talk about medications afterwards. My first goal is to establish that trust. Rapport is what we used in school a lot, establishing that rapport with patients, and just let them know who I am. And personally, my approach is, if you don't need to be on a medication, you shouldn't be. There are a lot of unnecessary medications out there that people are on that they've been on for 20 years that they don't need no more. My goal is to trim that medication list down. Not only will that, help them in the long run, it also will save them money. And with this economy, it's always good to save money. So that's my philosophy. It's the person first and medication second.
That's such a great mindset. The idea that health starts with the person, not the pill. You can really feel how much you care about your patient's long-term health and trust. Now, Sally, you're helping lead something exciting, our new Malvern Community Pharmacy that's opening soon. What's it like being part of that growth?
Very excited to join Healthy Connections and be part of a team at the Malvern Pharmacy location. I look forward to collaborating with other providers and providing access to both healthcare and medications for patients in the community who may not otherwise have easy access to these services. And I am proud to be on a team with a team approach to improve the healthcare for people in the Malvern community.
That's what Pharmacy Week is all about. Celebrating how pharmacists like you make healthcare more reachable and more personal. And that connection between the pharmacy and the clinic seems to be one of the biggest benefits for patients. What's that experience like for them?
It's very nice to see the patients get done seeing their providers and then come directly over to us and we can visit with them and hurry and get their prescriptions filled. I know as a patient myself in the past, you'd get some eye drops called in from your eye doctor and you'd go by the pharmacy maybe at the end of the day and they look at you and they'd say they're not ready. We try to have it so that when you get done seeing your provider, it's no more than maybe a 5-10 minute wait at the very longest to get your medicines all gathered up for you. And I think all the patients appreciate it. They appreciate getting to see the same people all the time. We get to know everyone's name, and we try to make it a personal experience for them.
That's such a great picture. A patient walking straight from their provider to a friendly face who already knows them. And Alicia, that's something you see every day in Mena, right? How does that closeness help your patients?
One really great thing about the Healthy Connections Community Pharmacy is that our patients are right next door with their providers, and they're able to just basically turn a corner and there's the window, and it's a one-stop shop where they're able to get those prescriptions filled. It's also easier to connect with their providers because they're in the same building, so I'm not necessarily in a queue waiting for a call back from a nurse for days at a time. I can just go across the hall if I need to get a hold of somebody really fast. So that's really great for them, and it's really great for us, and I think it increases patient safety.
That's fantastic. Convenience, connection, and safety all in one place. We'll take a quick break, and when we come back, we'll talk about how our pharmacists work hand in hand with providers to make care even stronger. Love isn't just what you say, it's what you do to protect the people who matter most. At Healthy Connections, getting tested is one of the simplest ways to show you care. It's quick, private, and gives you peace of mind. Taking that small step shows respect, honesty, and real commitment. It's about making choices that keep both of you healthy and strong. Protect your partner and your future. Schedule your confidential test today. Visit healthy-connections.org. Welcome back to Connected. We're talking with the pharmacy team at Healthy Connections about how pharmacists go beyond the counter. They're a part of every patient's care team. And you've built that teamwork into how we do things. How do pharmacists support providers and patients in ways people might not expect?
I think it's really important for our pharmacists to stay connected with the patients as well as keep their knowledge base up. We have some really unique diseases out there that they can really help tap into the right medicines and the right treatment and the right teaching for the patients. I know the providers love having them in the offices because they are a real wealth of knowledge and a help to them. They can give injections, they can oversee their overall care. What I did was with our EMD system was design it so that whenever a pharmacist is in the clinic and you come in to see us, all your latest med information as well as your latest labs are all dropped into your folder. And they can open that up in their section and they can look at all that. And if it's been a while since you've had labs that would be appropriate based on your disease or the medicines that you're on, they can suggest that and put those orders in. They can work right there side by side with the provider and make sure that they're getting the best care that they can.
I love that. It's not just filling prescriptions, it's helping guide care in real time. Sally, you're often one of the last people a patient sees before they leave the clinic. What kind of conversations do you end up having at that point?
Checking to make sure the right medication, the right amount of medication, the right dose, those are all part of the workflow. But more than that, collaborating with other providers and being a resource when they have questions about treatment plans or medications. We're a resource that they can tap into to help answer some of those treatment questions. And then our counseling each patient with new prescriptions and changes in their medication. Sometimes our conversations with patients are a little bit more open. We're usually the last step before the patient goes home. And so they have had their office appointment and their test run, and when by the time they get to us, we do often answer questions even more than just about the side effects of the medication. And we're open to those conversations and easy access for the patient to have discussions with before they go home.
That's so valuable. Sometimes that last conversation is the one that brings everything together for the patient. Alicia, I know safety is another big part of what you and your team focus on. What are you watching for behind the scenes to help keep patients safe?
A lot more goes into it where we're trying to make sure nobody's getting harmed, everything's correct, the dosage is right, nothing's interacting. Providers can check, but sometimes they don't know everything that the patient is on if they're not actually the ones that prescribed it to them. So sometimes they might have some things that transferred over before they became a Healthy Connections patient or things like that, that we're able to kind of get the full picture sometimes.
Exactly. It's the peace of mind that comes from having someone double-checking every step. We'll take another short break, and when we come back, we'll look ahead at what's next for pharmacy at Healthy Connections. The same fight plays out. The flu steps into the ring, ready to take its shot. It's fast, unpredictable, and always looking for a weak spot. But this time, you're ready to fight back. Your flu shot is your best defense, your chance to knock out the flu. Appointments and walk-ins are available now at Healthy Connections. There's no cost with most insurance plans. Step into the ring and knock out the flu. Learn more at healthy-connections.org/flu. Welcome back to Connected. And things are changing quickly in pharmacy, but Healthy Connections is growing right along with it. What can patients expect next?
We're really excited about the Malvern location. It's coming along. It's going to be big. It's going to be spacious. I think it's going to be a great place for the patients to stop by and get their meds. But most importantly, it's kind of like centrally located. And what we can do is, if you're seeing your provider, you can, jump in your car, and hopefully you're not more than about 10, 15 minutes away, and come on through the drive-thru and pick up your meds. We'll also have delivery services there as well as mail. But it's designed more to be right there where we can jump on the highway and go to Little Rock. We can jump on the highway and go to Arkadelphia. We're right there in Malvern. Pharmacy is changing. There's an awful lot of pharmacies that are closing out there. There's a lot of changes with the drug companies. We've seen 18 different companies through the last couple of years decide they weren't going to give us the discounts we used to. So with all these things changing and happening, it's a very dynamic time right now. I see the fact that we have pharmacy as being a real foundation in our company to make sure that our patients will get the medicines that they need, and everything will remain accessible to them. We currently have about 137 different pharmacies that we partner with and we have contracts with. So if you are living in a far, far away area and you like using the pharmacy in your backyard, certainly you can continue to do that. But we'd like to see as much of the business come into our main hub so that we can take care of you the best that we can.
And that's such an exciting time. And it's great to see Healthy Connections staying focused on access while everything in the industry is shifting. Fee, what will this new Malvern pharmacy mean for you and for the patients who depend on these services?
I think once Malvern's open, it's such a centrally located area for our clinics. Everything will be delivered quicker. Right now, we're operating out of Mena, and so everything's a little bit delayed. But once Malvern opens up, we'll be able to deliver things day of sometimes. And we'll also be able to provide for our employees as well, deliver to our clinics, do employee medications and patient medications. And so it's exciting. I'm super excited to see where it goes.
That sounds like a real game changer. Faster service and even more convenience for both patients and staff. Sally, that proximity to care has to make a big difference for people picking up prescriptions.
Having the opportunity to be in a pharmacy next to the practice where they have just seen their provider will streamline the patient's ease of getting their medication and but also compliance.
That's what it's all about. Care, connection, and compassion in every prescription. A huge thank you to our amazing pharmacy team, Dr. Calandro, Dr. Tang, Dr. Sally Kalkbrenner, and Dr. Alicia Kalinowski for sharing their insight and dedication to patient care. And we also want to recognize Dr. Gwen Herzig, owner of ParkWest Pharmacy, for her partnership and the work she does serving Healthy Connections patients in Little Rock. Healthy Connections Pharmacy Services is expanding to serve more patients across Arkansas, with locations in Mena and soon Malvern. For more information, visit healthy-connections.org. New episodes of Connected drop every Tuesday on Spotify, YouTube podcasts, Facebook Reels, and the Healthy Connections website. Thanks for joining us, and we'll see you next week for more Connected.